Well, warm welcome to today's talk. It's Friday the 25th of March. Now, it's happened again. We've set another record in the United Kingdom. The cases are higher than they have ever been through the entire pandemic. About 1 in 19 people at the moment in the UK is infected with SARS coronavirus 2. Quite incredible numbers. And it may well be that the United States is going to follow in this trajectory in the next few weeks as a result of the BA2 variant. But before we get on to that and look at some of the latest symptomatic data from the UK, let's just have a quick look at some orientation slides. Now, what we see here is this blue line here is the Denmark Omicron wave, BA2 of course. And this is the Netherlands Omicron wave here as well. And we just see how quickly they go up and how quickly they go down. Now, testing in Canada and the United States, of course, I get very variable reports from Canada, but overall we believe the testing's not very comprehensive in Canada. And surprisingly enough, Canada and the United States don't have an independent symptom tracker app like we do with the Zoe Tim Spector information, which is a real pity. So the data from the UK is better than anywhere else in terms of current day-to-day data, which of course I'm quoting there with that 1 in 19 figure. But there we have it. Australia cases going up, of course. New Zealand bobbing along against a very high vaccination background rate in New Zealand. So hopefully hospitalisations will remain quite manageable in New Zealand. Now here we have the proportion of variants, and of course Omicron is completely predominant. Denmark we do know was predominantly BA2. The United Kingdom is now majority BA2. And we believe the United States is now majority BA2 as well. But clearly this is the Omicron wave we are in. Now hospital patients. Now Denmark, they've been actually quite high. Whereas Netherlands, which had similar numbers of cases, has got much lower numbers of hospitalisations. Now, we don't actually know why this is. Why are hospitalisations been much higher in Denmark compared to the hospitalisations in the Netherlands? That's not entirely clear. We are looking out for an answer. I am looking out for an answer to that, but I don't yet have one. But we'll follow that with interest. And we see lower late hospitalisation in the United States, remarkably low. It's been the highest, way up there, and now it's way down. Australia going up slightly, Canada going down, Netherlands, as we've said, low. And the United Kingdom, as we can see, the hospitalisations are going up. But we do believe about 50% of these are admissions with COVID rather than from COVID, because the prevalence is just so high in the country at the moment. It's not surprising that this is happening. Patients in intensive care. Now, if we think about the time that Omicron started, which is like late December, early January, about here. So we did see an increase in the United States. And we did see an increase in Canada. But most other countries have seen a progressive decrease since Omicron started. So with the exception of Canada and the United States, we've seen Omicron has been associated, at least a temporal association, with a decrease in intensive care admissions, which of course is pretty good news. And the last slide I want to show today, I think, is this one. New daily confirmed COVID-19 deaths. Now, Denmark, again, they've been pretty high. The question in my mind is why have the deaths in Denmark been so much higher than the deaths, for example, in the Netherlands? It really is quite strange that there is this differentiation, and we don't. Well, I haven't worked out why it is yet, and I haven't seen anyone write up about why that is. But anyway, more on that hopefully soon, because there could be quite a lot to learn from that. So anyway, Denmark deaths going down. The United States, of course, going well down in deaths, though it did take a long time. United Kingdom going slightly up. New Zealand, Canada, Australia and Netherlands. So that's just a bit of a orientation as to where we are at the moment. Now let's move on to looking at this from the United States. BA2. Now this is from the Helix group. BA2 is probably about 70% of new infections in the United States. And this site here tells us that deaths in the United States, unfortunately, are now well over 1 million in terms of excess deaths. Let's have a brief look at those two sites. So this is the surveillance dashboard that I've referenced. The graphics are slightly out of date, but you do get a good breakdown by state and variant if you're interested in more data there. And here's the excess deaths in the United States, and this is broken down by states. Obviously we see the more populated states at the top, but pretty interesting. And we do believe that excess deaths is the most accurate way to look at this, and we can almost see anyway that there's about just over 1,045,000 deaths, although quite why that's not come out properly I'm not sure. Never mind. Now what we would like to see here more of is the deaths related to age, weekly number of deaths by age. So we have it here in the older age groups, but I've tried to get this sort of more, the younger age groups, we've tried to get a more detailed breakdown, but the graphics don't seem to give a more detailed breakdown. But you can actually take it from the individual points. So the data is actually there, if not particularly well presented. So if you're interested in the states, do look at those. Now I'm going to go straight on to the Zoe COVID symptom tracker data now, because this is quite incredible, the number of cases. So new symptomatic cases of COVID-19 in the UK on the 23rd of March. Should be updating for it yesterday anytime now. Really quite incredible. Click on explore the data. And do explore the data on this. It's quite excellent. And this is probably more up to date now, actually. This is probably up to date to yesterday. There we go. 3.7 million people. People are currently predicted to have symptomatic COVID in the UK. Quite incredible. New daily cases. And there we have the graph. This is the highest number it has ever been. It's an absolute record in terms of number of cases. Now, some pretty interesting stuff's come up from this. I want to look at it now. And bear in mind, we believe that this is caused by BA2. So I'm expecting, or it's reasonable to assume, that the United States could go in a similar way in the next week or two, because the BA2 in the United States, as we've seen, is probably now around about 70%. So that effect is going to start kicking in. If it doesn't, and I really hope it doesn't, but if it doesn't, it's going to be very interesting to work out why not. But I do still believe it is going to. The cases in the United States are going to go up. How well these will be detected with relatively low levels of testing and the absence of a COVID symptom tracker, large-scale study in the States, makes you wonder if we'll ever quite find out. It would be reflected in hospitalisations. That would be the issue. So Zoe data. Now, since May 2020, there's been 35 million positive cases of COVID in the UK. Incredible number. In the last 4 months, there's been 18 million cases due to Omicron. Due to the incredibly transmissible nature of Omicron. The only disease I know of that spreads slightly faster than Omicron is measles, and even that's not a lot faster. The BA2 anyway. It's just incredibly transmissible. 18 million people in the UK have had the infection in the last 4 months. That we know of. I mean, it's probably fairly accurate, but. Symptoms at an all-time high. So this is the highest they've ever been. One in 19 people in the UK, quite incredible, are currently symptomatic. They actually have the infection today, as of now. Mass infection across the country, and it's going up. The R value is 1.2. That means cases will continue going up. The R value is 1.2. When is this going to stop? It really is quite incredible. 1 in 19 in the UK currently infected. It's got to slow down at some point because of the amount of immunity that's being developed. But when? We don't really know that. The increase in 2 weeks ago was 50%. And the increase last week was another 26% on top of that. This is really surging high. Now, London and Scotland have the highest rates of transmission. Now, this is despite the continued mask wearing and other regulations in Scotland, which I think we have to conclude now simply haven't worked. As the Chinese are learning, you can't really stop Omicron, especially BA2. The increased regulations in Scotland have not worked. To stop Omicron, you would need completely draconian lockdowns like they have in China, Hong Kong to some extent, but then it's just going to come in next time there's a traveller. It's inevitable. It's like the tide, isn't it, as we've said before. Scottish restrictions don't seem to be working, so I think we have to start questioning whether Wales is the same. Wales have just released their restrictions, or announced some releasing restrictions. I do hope this isn't political. I think it really needs to change, because patently, if it's not working, don't carry on. If you're digging yourself into a hole, stop digging. And let's hope Scotland starts doing that, because it's starting to look a bit embarrassing, really. Deaths. Now, the risk of dying after vaccination is less than the average influenza. Now, what I'm saying here is the risk of dying if you get a COVID infection, if you've been vaccinated, your chances of dying now are actually less than your chances of influenza. So if you've had 3 vaccines, you get COVID, your chances of dying are less than with influenza. The chances of deaths are massively, massively reduced. And of course, in the past, we've just accepted influenza as a routine winter risk, and that the people that die of it tend to be older with comorbidities. But there we go. So COVID is now less deadly than influenza for those that have been vaccinated against COVID. Many people seem to catch COVID in hospital. As we say, the hospitalisation rates are very high, but this is largely because people are being admitted with it. Let's just have a look at some of the hospitalisation. Here's some of the official UK data here. Actually, patients admitted to hospital, so with a positive, or who test positive in hospital, and we clearly see it's going up. There's no question about that. It is going up. Patients actually in hospital. Again, let's look at the last month. Well, we've definitely got an increasing trend, but there again, we would do, because of the very high prevalence. There's a lot of COVID in the population, so a lot of people being admitted to hospital will have it. We saw exactly the same in South Africa. But the good news is the trend is essentially continuing. So this is when, let's look at when sort of COVID kicked in, about then in intensive care admissions, and they've gone down ever since. So there's a very strong negative correlation between the rise of Omicron and the decreased requirement for intensive care beds. It looks like Omicron is causing a lot less. Well, Omicron is causing a lot less intensive care admissions. Very slight increase lately, but there again, we have massively high numbers at the moment, but very, very slight. And I don't think we could really say that difference is significant at the moment from the UK data. Now, all age groups, Omicron is rising steeply in all age groups. They're all going up. All regions are rising steeply. And of course, if all age groups are rising steeply, that means the increase in the prevalence in older age groups, greater risk, is rising steeply as well. So some of these will be older people being hospitalised with complications, because there's so many older people and people at risk being infected now. So we are starting boosters for the over 75s in April. Quite how effective that's going to be, I don't think we have any trial data to reflect that. This is sort of being done on faith rather than evidence, as far as I can see. Reinfection rates were approximately 7%. Now, this is pretty high. So of the people that are getting infections, 7% of those have been infected before. Now, this is hard to do because you have to have a documented infection for the first time, documented infection for the second time. But it's looking like up to about 7% of people are getting infected twice, indicating, unfortunately, some waning of natural immunity. Now, it doesn't look like the waning in natural immunity is as much as the waning in vaccine immunity, but there is some, or is it some particular segment of the population that are more prone to reinfection? So of those currently infected, 7% have had the infection in the past. That is remarkably disappointing that is happening, that the immunity is shorter lived than we'd hoped, or at least in some individuals. We would need a more detailed breakdown of those individuals really to get information on that, but still disappointing that 7% are reinfections. And of course, virtually everyone in the UK is vaccinated now, so virtually all of these are breakthrough infections after vaccination as well. So the vaccination is not preventing symptomatic disease with Omicron. Symptoms. Now, it's 719 days since the government were advised by the Zoe symptom tracker data and Tim Spector's group to change their official symptoms. Now, here we have the latest symptoms here. I'm going to post the list, but this is it. So runny nose, most common. Fatigue, most people get fatigue, 70%. Headache, 69%. Sore throat, 69%. And you can see it all. I'm not going to run through it all. I'll put it all in the descriptions. But they are the symptoms that we're getting now. So here we have the symptoms from the government site here. And there we go. This is live from their website after 1,719 days. They have not amended it. Main symptoms of COVID-19 coronavirus, according to the government website, are a high temperature, a new continuous cough, loss of change or smell. This is simply untrue, as we have shown with this data here. It's presenting most commonly as a common cold. Now, why have the government not updated these guidelines? Why are they still putting this out of date, way out of date, over 700 days out of date information up? Now, to be fair, when the COVID symptom tracker data first came out, it probably wasn't that well verified, but now it is. This is now accurate, and you talk to any healthcare provider and they'll tell you how this is how COVID presents. So why haven't the government updated this? Why are they being deliberately, or apparently deliberately obtuse? Are they deliberately trying to treat the population like mushrooms? And I'm using strong language here because I feel quite strongly about this. Are they deliberately trying to keep us in the dark and feed us on manure? Is that deliberately what they're trying to do? Is this a disinformation campaign from the government? Or are government medical officers so incompetent they haven't realised the symptomatology has changed over the past 2 years? Or is there a third alternative that I haven't thought of? It's just unbelievable. Tim Spector said this is a national scandal, and I agree with him. So there you go. That's what the government says is the symptoms of COVID, according to the government medical officers. This is what we know to be the symptoms of COVID. It really is a national embarrassment that this is still like this. It just makes no sense whatsoever. But there we are. COVID is currently more common than cold. So at the moment, if you've got upper respiratory symptoms, it's more likely to be COVID than it is a cold. Now, this is varied from time to time. This has been the case before. COVID has been more common than colds before. Normally, colds are more common than COVIDs. But right now, 25th of March, if you've got upper respiratory symptoms, even if you're testing negative, the balance of probability is that is in fact a COVID infection, because it's more common than the other causes of cold at the moment, just because it is such a high prevalence level. And we are getting quite a few false negatives, of course. I mean, I've never tested positive, but I strongly suspect I've had it. But on the lateral flows, I've never tested positive. And of course, free testing is finishing from the 1st of April in the UK, so we're probably going to lose the data. And also, Tim Spector's group have lost its government funding, which again is inexplicable. I think the Office for National Statistics data, which is good as far as it goes, it doesn't give us data on comparison between illness and hospitalisation in vaccinated versus unvaccinated groups, especially people that have had the infection. It doesn't tell us that. We don't need to know that, apparently. We're simply not told that. But it costs masses more than the COVID symptom tracker data. And the COVID symptom tracker data is the one that's always bang up to date. So for a relatively small amount of money, 3 million a year, I think it is, we're going to lose this incredible source of data that's been validated against other data sets repeatedly. We know it's good data. And yet the more expensive Office for National Statistics government department data is being carried on. Well, I mean, no one's saying that the government doesn't want independent sources of data to compete with its own data. Of course not. But it is a pity that the COVID symptom tracker data is losing its funding. But we will still have the official government data, of course, which we've looked at here, which we looked at there. This is this one. I mean, how useful is this, though? Well, the testing's completely useless because we know the official numbers are actually way, way higher than this. The cases are a very small subset of infections, But we do know that the healthcare data is accurate, so that's useful. We do know that the vaccination data is accurate, and we do know that the death rate is accurate. So it is, the official government data is useful. But why the government has put such prioritisation on the Office for National Statistics rather than independent data gatherers, who knows? So if you can think of a third reason why the government would not have updated the symptoms, why they're still on these old-fashioned symptoms, let me know. Because other than a conspiracy against us all, or gross incompetence in the highest levels, which should mean that these staff are immediately replaced by competent staff, I'm struggling to think of a third alternative. Do let me know. So there you go, government. Why not change it on the 720th day after you were advised about this? So interesting for the next few weeks. What's going to happen in the United States? Is it going to follow the UK? I think it may well. If it doesn't, it's going to be one of those interesting sort of things to look at, like the difference between Denmark and Netherlands. What I'd really like actually is the BA2 data for Netherlands to see if it is the BA2 that's causing more disease than the BA1. But I think we don't really have the data to say that. So that's me thinking out loud, which I have a tendency to do. So I'll shut up there and thank you for watching today.